Good evening, my name is Michelle Alvarado. My topic IDH2 Mutation in a patient with metastatic colon cancer. Definition: genes encoding for isocitrate dehydrogenase 1 and 2, IDH1 and IDH2 are frequently mutated in a multiple types of human cancer, abnormal histone and DNA methylation are emerging as a common feature of tumor with ID and IDH2 mutation and may cause altered stem cell differentiation and eventual tumor genesis. Metastasis occurs when the cancer has spread to other parts of the body. When colon cancer spreads, it most often spreads to the liver, although it can sometimes pass into the lungs, bone, and other organs of the body. The first time mutation in these genes were associated with cellular metabolism. With cancer was in 2008. Video.
I think the big thing in the last 6 months or so has been the extended RAS story in colon cancer. We know based on data at Big ASCO in 2013 that looking at an extended RAS mutation assay beyond exon 2 and also looking at NRAS mutations, we can now basically focus our treatment with anti-EGFR therapy on a patient population that is more likely to derive a benefit from this modality of treatment. And I think the continuum of this story continues at GI ASCO in 2014, where we see several abstract presentations looking at this, including an oral presentation that will be presented, which is a follow-up on the 181 study, which basically also reports findings that patients who have non-exon 2 RAS mutation, KRAS mutation, as well as NRAS mutations do not benefit from anti-EGFR therapy. And I think that's going to move the field forward and reassure all the clinicians that we have to move beyond KRAS mutations in the selection of anti-EGFR therapy for patients with metastatic colorectal cancer.
Application in nursing, talking vital signs, patient weight control, balanced diet, control of pain, managing with analgesics. Pros and cons. Advertised. Patients with this mutation in their tumors appear to have a better prognosis with a longer survival. Disadvantage: the calling of the gelatin, the IDH1 or IDH2 mouse model probable reflect the strong toxicity produced by the tumor-derived IDH1, IDH2 mutant that can severely block normal mouse development. Video.
There are two drugs that are currently under study, and some data were presented regarding during this meeting. One was a drug from Agios Pharmaceuticals called AG120, and another from Novartis, IDH305, both of which inhibit IDH1 altered proteins in patients with IDH1 mutation. Another drug, AG221, targets IDH2 altered proteins. IDH2 mutations are more common than IDH1 mutations. They're a very interesting alteration. They lead to the proliferation of an oncometabolite called 2-hydroxyglutarate, which inhibits TET function and causes aberrant methylation profiles, shutting down normal differentiation of marrow cells. So when you block that altered protein, it allows release of that block, and then normal myeloid maturation and differentiation, and patients actually begin to develop normal white cells again, and instead of having a marrow full of leukemia, over time they develop more and more mature cells and develop a response. Now, the response rate, the complete remission rate, depending on the study you look at, ranges between 20 and 30%, so it's not all patients that respond, but the overall response rate is higher. At least with the AG120 and AG221 studies, the overall response rate that includes also morphologic leukemia-free state, partial responses, they tend to reach the 40% marker. So it's impressive for this patient population that has a specific type of mutation. Mainly because many of them have relapse refractory disease for which there aren't other options. And so if you are able to achieve a response in this patient population, perhaps you can take them to a curative modality such as transplant and attempt to cure them of their disease.
Issue apply in Ecuador. Not applicable in Ecuador. Additional studies on numerous tumor types have revealed that mutation in IDH1 or IDH2, finally, mutant enzyme inhibitor IDH1 or 2 have entered clinical trial for patients with IDH1 or 2 mutation and represent a new class of drug for target therapy. In conclusion, and in my opinion, discovery and subsequent investigation of IDH1, IDH2 mutation in tumor have renewed interest in research of tumor metabolism, identify a good biomarker for early detection and prognosis of various types of tumor. Bibliography. Thank you.